Welcome to DEMOCREPUBLIX, where we cover the real news that matters to we the people. A new study claims to show a positive correlation between the severity of city lockdowns in the 1918 Spanish flu pandemic and their subsequent economic recovery. The working paper from economists at the Federal Reserve and MIT examines the impact of 1918 pandemic and what they call non-pharmaceutical interventions on real economic activity. Non-pharmaceutical interventions (NPI) are measures that include social distancing, shutting down non-essential businesses, and telling the population to stay at home. The authors found that the pandemic itself had a sharp effect on the economy, regardless of lockdowns, as people feared going out and changed their spending and working habits. They also found that cities with faster or more stringent lockdowns did not experience worse economic downturns following the pandemic. In contrast, evidence on manufacturing activity and bank assets suggests that the economy performed better in areas with more aggressive NPIs after the pandemic, the authors wrote. The study offers several caveats to the findings. The first is that the U.S. economic situation in 1918 was overall very different than it is today, as the country was just emerging from World War I. As well, they add, the complex nature of modern global supply chains, the larger role of services, and improvements in communication technology are mechanisms we cannot capture in our analysis, but these are important factors for understanding the macroeconomic effects of COVID-19. And as Ars Technica reporter Kathleen O'Grady notes, cities that responded faster in 1918 tended to be farther west and had warning as they watched the outbreak unfold on the East Coast. But this also meant that places that shut down sooner had economies that were relatively agriculture-based, O'Grady writes. This means that there were two simultaneous differences between groups of cities, making it difficult to tell which difference was more important. The authors attempted to control for this difference by accounting for the relative importance of agriculture compared to manufacturing and local economies. Altogether, our evidence implies that pandemics are highly disruptive for economic activity, the authors write. However, timely measures that mitigate the severity of the pandemic may also reduce the severity of the persistent economic downturn. That is, NPIs can reduce mortality while at the same time being economically beneficial, they continue. Manufacturing employment increased by 6.5% in cities that imposed restrictions for an additional 50 days after the pandemic arrived, according to the study. The researchers appear to be contradicting claims made by President Trump and several other Republicans who fear that the cure may be worse than the disease and that ways should be found to reopen the economy while trying to contain the coronavirus. Regardless, the lockdowns have had a devastating short-term effect on the U.S. economy, with more than 16 million. What was Spanish flu? The 1918 flu pandemic was unusually deadly and the first of two involving the H1N1 influenza virus. It infected 500 million people globally, more than one-third of the world's population, including people on remote Pacific islands and in the Arctic. It resulted in the deaths of an estimated 3 to 5% of the world's population, making it one of the deadliest natural disasters in human history. Within months it had killed 3 times as many as World War I and did it more quickly than any other illness in recorded history. Most influenza outbreaks disproportionately kill juvenile, elderly, or already weakened patients. By contrast, the 1918 pandemic predominantly killed previously healthy young adults. To maintain morale, wartime censors minimized early reports of illness and mortality in Germany, Britain, France, and the United States. However, newspapers were free to report the epidemic's effects in Spain. This created a false impression of Spain as being especially hard hit, leading to the pandemic's nickname Spanish flu. The close quarters and massive troop movements of World War I hastened the pandemic and probably both increased transmission and augmented mutation, researchers believe. The true global mortality rate from the pandemic is not known, but an estimated 10% to 20% of those who were infected died. This would lead to a death toll of between 50 to 100 million people. Let us know what you think. Leave your comments down below. Like, share and subscribe. And check out DEMOCREPUBLIX.com for the latest in news. Until next time.
We live in a really nightmare. We live in a really nightmare.